Briefly about the patient history, we have Aziz Fatima, 65 years old female. She is a known case of hypothyroidism for the last 20 years, taking thyroxine 50 microgram, and she has Parkinson disease as well for the last 1 year on Cinamate, and she is also hypertensive. Basically, she presented with a complaint of abdominal pain, constipation, 1 month back in some private hospital. After doing initial baseline labs and CT scan, the CT was suggestive that there is a lesion in the gastric cardia, which is around 1.8 to 1.2 centimeter. So we did endoscopy. The endoscopy showed a polypoidal lesion in gastric cardia and fundus region. In the fundus, most likely. So there was no superficial ulceration. So it was not clear either it was gastric polyp or there was a submucosal lesion. So we decided to do the US endoscopic ultrasound, and if needed, FNA or FNB.
Thank you, bhai.
Okay, G junction. So, where's the liver? Show me the liver. No, come back at the E junction. On top of the diaphragm, above the diaphragm, there's going to be heart. Below the diaphragm, it's going to be liver. Okay, so this is your liver. Okay, so slightly pull back, pull back, pull back, pull back, pull back. Okay, little bit more. Now you can see that there's IVC. Pull back slightly more. And the white line that you see on your right side, that is diaphragm. Slight pull back. Pull back, pull back, pull back, pull back, pull back. You see the white line that you see is coming from the diaphragm, right? So above the diaphragm, it's going to be heart. Below the diaphragm, it's going to be liver. This is your IVC. Yeah, this is liver, ji, bilkul, this is liver. And above the liver, you can see that there is heart, right atrium. So, what exactly do you want to do? अब straight away submucosal lesion पे ना जाओ. I've already said that in US it's always station approach. Even if you know that what you're looking for, you have to go by the station. You have to go by your methods. It's just like doing clinical method examination in any patient that you see in your clinic. So, although you know that the case has been referred to you for cirrhosis of liver, but you apply the complete clinical methods of your GI tract and rest of the examination. Similarly, in US examination as well, you have to apply the clinical methods, and that is station approach. In the station approach at the E junction, you have to identify the abdominal aorta. And in relation to the abdominal aorta, you have to look at the structures step by step from the abdominal aorta to the celiac artery, from celiac artery to the pancreatic duct, and from pancreatic duct to the tail and to the other side. Now, when we want to look at the wall of the stomach, we'll discuss how to look at the wall of the stomach. Basically, any viscous has got 4 layers: mucosa, submucosa, mucosa, and serosa. So anything starting with S, irrespective of whether it is S of submucosa or S of serosa, is going to appear echogenic. One mucosa and M and M, they are going to appear black. So blacks to white. That's something that you need to learn. That's something that you need to remember. हाँ, देखो चीज़ है कि the one which closer, the black line which closer to you is going to be mucosa. Then there's going to be a white line which is going to be submucosa. then there's going to be a black line which is going to be a muscle, and then there's going to be a white line which is going to be serosa. So one has to look at the 4 layers with the curvature while you're rotating the transducer from one side to the other. और उसके लिए बेस्ट ये होता है कि आप जिसकी स्क्रीन है उसको ब्लो अप कर दें। अच्छा, अभी हम क्या करें? देखो, आप इस वक्त जो चीज़ आप सीखना चाहते हो वो है कि क्लिनिकल मेथड्स। सो फॉलो द क्लिनिकल मेथड्स, forget about the diagnosis, forget about the specific thing that we are looking for. Right now your mandate is to perform the clinical methods, so kindly perform the clinical methods. Where is the abdominal aorta? नहीं, abdominal aorta आपको क्या समझाया था कि it is towards the posterior side. So right now you're looking at the anterior side, lever is anterior, so you need to rotate yourself to the posterior side. Only then you're going to go to the aorta. So keep rotating to the clockwise side. Keep rotating unless you find 2 parallel lines with a central dark lucency. Keep rotating. ठीक है? Do you need some help? दिखाओ जी। ये देखो, आपका जैसे ही आपने रोटेट किया था बीच में आपको मिल गया, छोड़ो तो। अच्छा, ये आ गया। मैंने क्या किया? मैंने स्कोप को इंडिपेंडेंटली रोटेट होने दिया। नाउ द स्कोप इज नॉट सपोर्टेड बाय द हेड नर्स, it's not supported by my hand. This is the aorta and I need to slide along the aorta, and the first vessel which is going up, that is the celiac artery, right? This is the celiac artery, this is abdominal aorta, this is celiac artery, this is pulmonary artery. So once I've seen that, once I've identified the celiac artery, big wheel slightly away from you, and then push it along the celiac artery. Push it along the celiac artery, and then celiac artery is going to get divided into 2 structures, and that is, one is artery, the other is vein. And dropped off. In between the 2 vessels, the solid pepper appearance is going to be that of the pancreas. ठीक है? Is this patient obese? Because this she's got hyperechoic pancreas, तो fatty pancreas यहाँ पाकिस्तान में कोई इतना uncommon नहीं है। अच्छा, यहाँ पे अब हमारा mandate है कि we have to find the pancreatic duct. तो ये pancreatic duct आपको मिल रही है। So pancreatic duct from splenic artery, we need to jump to the pancreatic duct. So once the pancreatic duct is there in our frame, pancreatic duct under the transducer, rotation to the right, and big wheel up, we start going towards the tail of the pancreas and towards the adrenal, and towards the left kidney, and towards the ये single sign बना, and towards the spleen, right? ये किडनी आ गया नीचे, ये स्प्लीन आ गई, ठीक है? दिस इज किडनी लोअर डाउन, दिस इज किडनी, दरमियान में आपका मेडला, ऊपर कॉर्टेक्स, एंड दिस इज स्प्लीन, और इन दोनों के दरमियान में टेल ऑफ द पैंक्रियास, ठीक है? समझ आ गई बात? तो जी, ये सिगल साइन, ये दरमियान में एक विंगोस का, एक के साइड पे, राइट? लो, अब इसकी प्रैक्टिस करो, बोल जाओ कि इसका क्या लेशन है। यू आर हेयर टू लर्न द क्लिनिकल मेथड्स, सो फर्स्ट ऑफ ऑल यू नीड टू लर्न द क्लिनिकल मेथड्स।
Sir, how we can differentiate between aorta and IVC without putting
ये क्या?
How we can differentiate between the aorta and IVC without
Okay,
putting
IVC is baggy, distended, and one can see the sluggish flow in the vein, while aorta is smart, pulsating, You can't really see the blood flow in that. It's a rapidly flowing fluid. Now, if you put the Doppler, there's going to be pulsatile flow in the aorta, while in IVC it's going to be a continuous venous type of flow. अच्छा जी, वापस clinical methods.
Yes, sir.
Aorta. Where's aorta?
This one.
Come back.
ना पीछे आओ. अब जाओ राइट पे. ये किडनी पे आप आ गए ना, तो किडनी तो फिर एब्डोमिनल स्ट्रक्चर आ गया.
Gaspai, can you hear me?
Yes, I can hear you.
So we have only one room available to do all the cases.
Okay.
And, so I think if we can finish it in 10 minutes, that would be great.
Okay, fine.
Okay.
Where?
But even though it's an excellent demonstration, we would hate for it to finish. But
Okay, in that scenario, what I'll do is that I shall teach Afan station each station, and once he's good with that, he's satisfied with that, we'll go to the lesion straight.
okay.
Is that okay?
Yes.
Okay, fine. अच्छा जी, मुझे दोबारा एओर्टा दिखाओ. मैं आपको पहले कि अपने हाँ नज़दीक रखो, अपने चेस्ट के नज़दीक रखो. इसको हाँ अब घुमाओ. हाँ, ये आया था एओर्टा. ठीक है, थोड़ा सा पीछे पुल कर दो. ये आई ना एओर्टा आपकी. नाउ फॉलो द एओर्टा. लुक एट द सिलिक टेक ऑफ. एओर्टा कहाँ पे गई? हाँ, फॉलो द एओर्टा, पुश अलोंग द एओर्टा व्हाइल कीपिंग द. देखो, इम्पोर्टेंट चीज़ यहाँ पे ये कि जिस चीज़ को आपने रेफरेंस बनाया ना, कीप दैट थिंग अंडर योर ट्रांसड्यूसर अनलेस you find a new reference. So right now your reference is aorta. So while aorta is underneath your transducer, move forward from that reference point till such time that you are ready to jump to the new reference point.
सर ये आगे
हाँ, नहीं, ये देखो आप aorta से आपने celiac artery पे जाना है. जब celiac artery पे जाओगे, big wheel slightly away from you and slight gentle push further. So where is celiac artery?
this
ये आगे celiac artery, big wheel slightly away from you. नहीं, ये देखो आप वो एक चीज़ आदत तब भी बनाओ कि you need to stay away from the air. Air, something which is not required in the US. So never ever insufflate air. के बाद बात आप अपना उसको एयर का बटन ही स्विच ऑफ करवाते हैं. So once again go back to the aorta. Once again go back to the aorta. No air. देखो ना 50 है तो we need to pull back to 40. ये aorta आ गई आपकी straight. Aorta to celiac artery. हाँ, aorta to celiac. Just gently push along. देखो आप अपना हाँ ये स्लाइड जेंटल पुश. ये आ गई आपकी celiac artery. बिग व्हील स्लाइटली अवे फ्रॉम यू. ठीक है, एंड नाउ फॉलो द celiac artery. बिग व्हील स्लाइटली. ठीक है,
yes sir.
यानी आपने एओर्टा से अगले रेफरेंस पॉइंट पे celiac पे जंप किया. हाँ, अंडर योर ट्रांसड्यूसर. ठीक है. अच्छा, नेक्स्ट है कि celiac artery से आपने splenic artery पे जाना है. ठीक है, splenic artery से splenic vein and then to the pancreatic duct. So that's how you jump from one reference point to another and get to another, and with reference to those reference points you make your assessment of the lesion. Agreed?
Agreed.
Chalo.
Thank you sir. Thank you.
Sphenomesenteric artery. Okay. So first takeoff is obviously celiac artery. Okay. And the second one is sphenomesenteric artery. अभी मैं आपको दिखाता हूँ। जब आपका किडनी आ जाए तो ऑब्वियसली दैट मीन्स दैट यू ओके निकाल ले। अभी अभी ठीक हो जाता है, कोई बात नहीं। So, Dr. Khalid, patient has desaturated. For the time being, anesthetist has asked us to hold the procedure.
Okay.
We'll go in again.
Okay.
This side, Khalid.
इवन पे एक तो पोर्टल वैन होती है साथ ही उसमें पीडी आती है, पीडी आता है या उसके बाद
देखिए आपका पहला है रेफरेंस पॉइंट, दैट इज पोर्टल वेन। पोर्टल वेन से आप जंप करते हैं टूवर्ड्स सीबीडी। पोर्टल वेन से इस साइड पे आपकी दो ट्यूब्स होंगी, एक होगी गैस्ट्रोड्यूटल, दूसरी होगी आपकी सीबीडी। तो जो डॉपलर पॉजिटिव है वो गैस्ट्रोड्यूटल या पैंक्रियाटिक ड्यूटनल होगी, जो डॉपलर नेगेटिव होगी वो सीबीडी होगी। तो आपने आइडेंटिफाई करनी कौन सी नेगेटिव है। जो डॉपलर नेगेटिव राइट टुवर्ड्स द पेपिला एंड लेफ्ट टुवर्ड्स द हाइलम। बिग व्हील अप, बिग व्हील डाउन, दैट्स हाउ यू डू इट। यूएस में एयर नहीं देनी,
जी जी बिल्कुल,
यूएस में एयर नहीं देनी।
क्योंकि हमने
कीप योर फिंगर अवे। हम लोग का जो रूटीन एंडोस्कोपी में वी आर यूज्ड टू
Give air.
इंसफलेटिंग एयर। यूएस में नो एयर।
राइट